Health experts and civil society groups are raising alarm over excessive salt consumption in Nigeria, warning of its link to rising cases of hypertension and other non-communicable diseases. They are now calling for urgent government action and increased public awareness to address what they describe as a growing health crisis. Comfort Olayinka reports.
Nigeria's escalating health concerns linked to high salt intake have come under renewed scrutiny as stakeholders push for decisive action to curb the trend. At a media training organized by Corporate Accountability and Public Participation Africa, experts highlighted the dangers of excessive sodium consumption, describing it as a major driver of non-communicable diseases across the country. A representative of the Federal Ministry of Health and Social Welfare, Dr. Femi Stephen, revealed that Nigerians consume nearly double the recommended daily sodium intake set by the World Health Organization. He added that this contributes significantly in the country's high hypertension rate, currently estimated at 38% amongst adults.
One of the alarming numbers that we have is that we are consuming about 3.9 grams of sodium per day per person, as against the recommended 2 grams. So that's about double the expected consumption of sodium in our diet in the country. So I think the government has taken a leap forward to reduce this burden, and we are eager to get the populace together to work with the country to demand low salt foods or consume low salt foods in our diet.
Other health experts, Joseph Ekio, also pointed out that current sodium guidelines lack legal backing, urging authorities to move from voluntary compliance to enforceable regulations.
Globally, targets have been set as mandatory maximum limits as far as salt is concerned in different food groups. So the amount of salt that is acceptable in bakery products is different from the amount of salt that is acceptable in other products. So in the interest of health and in the interest of sanitizing our food environment and making what gets on our plate healthy, there is a mandatory maximum limit that has been set by the World Health Organization, in the different food groups. It will interest you to know that in Nigeria, we already have salt guidelines as per how much salt is acceptable in the different food groups, But guidelines are not enforceable. Guidelines is soft law.
Facilitators at the training also charged the media to intensify public education efforts and hold both government and the food industry accountable.
Last year, the Nigerian government reflected on the problem and launched national sodium reduction guidelines as part of a comprehensive strategy to combat non-communicable diseases by setting salt targets for priority food categories. The guidelines, the nutrient profile models, and the push for mandatory front-of-pack warning labels are confirmed steps and tools towards a healthier Nigeria. However, as good as those initiatives are, they are the risk of derailment if the public does not understand them, if the media does not hold powerful corporations who want to interfere and derail them accountable.
As the country grapples with the silent health threats, experts say reducing salt consumption could play a critical role in saving millions of lives. Comfort Olayinka, MITV Plus News, Abuja.